You've been lied to repeatedly by the very system designed to protect you. You've been told your depression and anxiety are due to chemical imbalances. You have mood swings, so you've been labeled bipolar. You have high blood pressure because it runs in your family. And your weight gain and chronic fatigue are just due to aging. But what they didn't tell you is that most of your symptoms are signals from your body trying to communicate something with you, not lifelong sentences. Every time you walk into that doctor's office and walk out with the prescription, no questions asked, every time you're told it's just genetics or this is your new normal, that's another dollar towards a system profiting off of you being sick and keeping you stuck with an identity centered in your diagnosis. The healthcare system is not designed to heal you. It's designed to manage your condition because managing you is more profitable than curing you. Hi, I'm Kristi, a board certified nurse practitioner, health coach, and trauma survivor. This is Trauma Free, where I help you change your mind and change your life, just like I did. Listen, I understand what you're going through because I've seen firsthand how patients are misguided through my own personal experiences in healthcare, and I've also spent over a decade in nursing, watching patients being labeled and zombied out by medications that were never meant to heal them. And I'm here to tell you the truth. You've been miseducated by a system that profits from you being unhealthy. So if you've ever wondered, why do I still feel like this, even with the medications I'm taking? Or is there a way to actually heal and not just suppress my symptoms? Then this video is for you. So let's talk about what they don't want you to know and how you can reclaim your health, your body, your mind, and your life. But before we go any further, it is my responsibility to state if you're currently taking any prescribed medications, please don't stop them abruptly because that can be dangerous and your health comes first. Always work directly with your doctor to make any changes to your medication regimen. And if you do decide to taper off, do it safely under medical supervision. Now that we got that out the way, let me be honest with you. Most doctors today don't treat the whole person. They treat only parts of the person. I've seen this in so many instances where someone walks into a clinic with anxiety and they're handed a prescription before even being asked about your past traumas, your gut health, your stress levels, or your sleep. Or the person that gains 20 pounds and they tell you to eat less and move more without ever testing your hormones or asking how long you've been emotionally eating to self-soothe after your trauma. Let's be clear, a diagnosis should be a starting point, not a life sentence. Yet so many people get handed a label and then they just accept it. They say things like, I'm bipolar, I'm just an anxious person, or diabetes runs in my family. But what if you chose not to accept your diagnosis and embrace these symptoms as signals from your body and not fixed realities? 1 in 5 Americans are on psychiatric medications, and yet depression and anxiety rates have jumped over 30% in the last decade, and 70% of antidepressants are prescribed without evaluating sleep, diet, trauma, or gut function, all of which are proven contributors to mental health. Chronic illnesses, including obesity, diabetes, hypertension, and depression, are now the leading causes of death globally, yet over 80% is preventable through lifestyle changes. That means that these are fixable factors, but the system doesn't have time to fix them because it's faster to write a prescription and move on to the next patient. I can remember being in clinics watching patients cycle in and out every 30 days, same faces, same complaints, same meds, or maybe a few tweaks to their regimen every so often. And that's when it hit me. This wasn't healing. This was simply disease management, keeping people in a vicious cycle at the expense of their own health. I want you to know that words are powerful and labels stick. When you say you have anxiety, you are bipolar, or you are diabetic, your subconscious wires it in as your identity. You claim that struggle as a part of your self-image, and that keeps you locked in it. And that's how the system wins. Because once you believe you are that diagnosis, you become a customer for life. But you are not your diagnosis. You are simply living in a system that never taught you how to get to the root of your health. And the same system benefits from you staying sick. I want you to know that if your body created that imbalance, your body can also restore it with the right tools, support, and knowledge. I want you to imagine this. You're sitting in a locked room. You've accepted that there's no way out, but no one told you that the key to the door was behind you the entire time. That's exactly what the healthcare system has done to millions of people. It's trained you to believe you're powerless, broken, and genetically doomed. So you stop trying, you stop asking questions, and you stop believing that healing is even an option. This is called learned helplessness, and it's a condition in which a person suffers from a sense of powerlessness, arising from persistent failure or trauma. It was first studied in dogs that were repeatedly exposed to uncontrollable shocks, so they stopped trying to escape, even when escaping became possible. And humans are no different. You say things like, my family has always had high blood pressure. I've always been anxious, and I just can't lose weight on my own. And eventually, you internalize it as your identity, not because it's true, but because it's been repeated. But thanks to epigenetics, we know your DNA is not your destiny. Your choices, environment, and your beliefs can all influence how your genes express themselves. In other words, you're not stuck with what your parents passed down. You can turn off diseased genes and turn on healing ones through the way you eat, move, think, feel, and live. For instance, the ACE study found that individuals with high trauma scores were 4 times more likely to suffer from depression, 2 times more likely to develop chronic disease, and significantly more likely to experience autoimmune conditions, obesity, addiction, and even cancer. But when you heal your trauma, you reduce your disease risk because your nervous system, it can regulate again. Your brain can rewire your body and you can come back into balance. That constant anxiety, it may not be just who you are. It could be unhealed survival patterns. That resistance to change, it might not be laziness. It could be your nervous system stuck in freeze mode. But no one taught you that. They just gave you a diagnosis and a prescription and sent you on your way. I've met so many patients who've been on 5, 6, even 7 medications and still feel horrible, still anxious, still hopeless, and extremely exhausted from their circumstances. And no one ever asked about their childhood, their stress, their diet, or their beliefs. Instead of accepting your fate, you need to ask why before you accept what. And challenge the idea that this is just how life is, because the system profits from you being stuck, but you profit from being free. You've been taught that once you get a diagnosis, that's it. But science and my personal experiences say otherwise. The brain has a direct effect on the stomach and intestines because 90% of your serotonin, your feel-good hormone, is produced in your gut, not in your brain. This causes the gastrointestinal tract to be sensitive to emotions like anger, anxiety, sadness, and happiness. All of these feelings and others can trigger symptoms in your gut. And if you're feeding yourself a diet of processed food, sugar, and chemicals, you're not just hurting your stomach, you're inflaming your mind because junk food, it causes gut inflammation, which in turn causes brain fog, stress, depression, and anxiety. Probiotics in fermented foods like kimchi, sauerkraut, and kefir, cutting processed sugar and getting quality sleep can help, but instead, people mask their symptoms with medications while ignoring their actual biochemistry. It's been shown that weightlifting is more effective at reducing long-term anxiety than Xanax without the addiction risk, mental fog, or long-term cognitive effects. And let's be clear, you don't need a gym membership to reclaim your mental health. You need consistency, movement, and sunlight. After I was shot 4 times with the AK-47, I didn't numb myself with medications. I didn't medicate my pain away. I went within. It was hard work, but I rebuilt myself from the inside out. No prescriptions could have given me what healing has gave me. That's not to say that medications don't help some people. And in certain instances, they are needed, but they should never be your only plan. Let's debunk a few myths right now. Diabetes doesn't mean you're doomed. In fact, it's known that type 2 diabetes is fully reversible through carb restriction, intermittent fasting, and lifestyle changes. No, you don't need lifelong insulin. You need insulin sensitivity, not insulin dependence. Obesity, it's not always about laziness. If it were just about calories in versus calories out, people wouldn't be starving and still gaining weight. This is about hormones, trauma, sleep, and leptin resistance, which occurs when the body doesn't respond properly to the hormone leptin, which signals the brain to reduce appetite and increase energy expenditure, which can lead to increased food intake, weight gain, and other metabolic issues. So if you can fix the signals your body is sending, then your body will recalibrate. And high blood pressure, it's not just about salt intake. Mainstream medicine still says that salt is the villain, but research shows that sugar, stress, and poor sleep are more important contributing factors. And there are some natural fixes backed by science you may want to try, like beet juice that's high in nitrates, which lowers blood pressure, potassium-rich foods like bananas, spinach, avocados, deep breathing and nervous system regulation, walking after meals to balance your glucose levels, and cutting out seed oils like canola, soybean, and corn because they're highly inflammatory, yet they can be found in nearly every packaged product in the grocery store. I hope you're starting to see. You're sick because the system profits when you stay misled. But knowledge is power, and once you know better, you can do better. Here's something I've noticed. Most people aren't healing because deep down, they're not really trying. And it's not because they're lazy or they don't want to. It's because they've been conditioned by society, by the medical system, and by fear to believe that healing is either impossible or too uncomfortable to pursue. Let's think about this. There's comfort in the sick role. It sounds strange, but there's comfort in dysfunction, especially when it's all you've ever known. Being sick gives people identity. It gives them community, and it gives them permission to not show up fully. It's easy to let a diagnosis become stop signs and say things like, I can't work, I'm bipolar. Healthy eating is impossible, I have PCOS. Consistency, I can't, I have ADHD. Instead of being taught how to regulate, how to reverse, or how to reclaim, we're praised for simply surviving. Then there's the fear of responsibility because healing requires change, and change requires ownership. It's much easier to blame your parents, your genetics, or your diagnosis. Just take the pill your doctor gave you and search for hacks that give you the hope of a quick fix instead of doing the real work. But freedom isn't found in a prescription. It's found in your mind. When you take ownership of your mind, body, and your pain, you stop waiting for someone else to save you, and that's when healing begins. Big Pharma doesn't want you well because this is a big business. In fact, the pharmaceutical industry made $1.2 trillion in 2024 alone. Do you think there's any financial incentive for them to cure you? Absolutely not. They don't want your wellness. They want your return visits. They want you medicated, sedated, and confused. Because a healed person doesn't need the hope they're selling. Look at Ozempic. It's a modern day cautionary tale. Right now, we're watching history repeat itself in real time. This drug is being pushed like candy for weight loss. But what they don't tell you is this. People are already experiencing gastroparesis, a condition where your stomach becomes paralyzed and food literally rots in your digestive tract. And the long-term side effects, well, we won't know until it's too late. Just like Xanax, Oxycontin, and Vioxx. We've seen this before. They seduce you with quick results and leave you with long-term consequences. I've seen patients being prescribed Ozempic with no lifestyle guidance, no dietary support, no education about what this drug can do to their bodies, and patients are even unaware of the correct dosage to take when self-injecting. They're just handed a pen and said, "Take this, it'll fix you." We're living in a system that normalizes sickness, monetizes suffering, and gaslights healing. You've been lied to, but you can change your circumstances. So let's talk about how to take control of your health and well-being. Step 1. Reframe your identity. Healing doesn't start with food or exercise. It starts with the words you speak over your life, because language creates reality. If you say things like "I'm diabetic," you should rephrase that to "I'm learning to stabilize my blood sugar." "I have anxiety," to "I'm working through this moment of feeling anxious." Or "I am broken," to "I'm becoming whole again." The way you speak is so important because neuroplasticity shows us that what you're repeatedly exposed to becomes hardwired into your brain. So start affirming what you want to become, not what you've been labeled. When I stopped calling myself a victim and started calling myself a survivor, everything shifted. When I began to see myself as capable and not cursed because of my circumstances, I got my power back. Step 2. Find your root cause. Symptoms are messengers. Your body is trying to tell you that something is out of balance, so start asking some real questions. Like, what's keeping my nervous system dysregulated? Why am I craving sugar, chaos, or comfort food? What trauma haven't I addressed? Am I sleeping poorly? Or is my gut off? Because chronic inflammation has been linked to everything from depression to diabetes, Alzheimer's to autoimmune disorders, and obesity. Step 3. Choose your lifestyle over lifelong medications. Prescriptions have their place, but they were never meant to be the only plan. Start replacing prescriptions with powerful proven practices. For mental health, morning sunlight is beneficial. It resets your circadian rhythm and boosts serotonin. Strength training increases brain-derived neurotrophic factor, or BDNF, your brain's growth hormone. Breathwork plus vagus nerve toning regulates anxiety and trauma responses. And for gut healing foods, eat fermented vegetables, bone broth, and clean proteins. For physical health, walking after meals reduces blood sugar spikes. Beet juice lowers blood pressure naturally, and intermittent fasting promotes insulin sensitivity and weight loss. Deep sleep activates healing plus hormone regulation, and cutting out seed oils and processed foods that cause massive inflammation. I started improving my health by just walking daily. I stopped eating for comfort and started eating for fuel. I didn't wait until I was motivated. I just began, one small step at a time, and that helped me to gain control over my health and my life. Step 4. Build a healing environment. Healing in isolation is almost impossible. You need support, a mirror that reflects who you're becoming, not who you were. So surround yourself with other people who have overcome their health conditions. Get mentors who teach healing that addresses the root cause, and find voices that speak life and not fear. You don't have to accept your diagnosis as a lifelong sentence, but you do have to accept your responsibility for your life, because unfortunately, nothing is going to come save you. Not a doctor, not a prescription, not the newest health craze. It all starts with you. So if you're ready to change your mind and change your life, make sure you subscribe, because this is where we do the deep work for our health and well-being. And in the comments, I want to know, Drop one limiting belief that you're ready to rewrite because your story is still being written. Don't accept a diagnosis as your destiny. Challenge it, investigate it, and heal it because you can. And if you like, download my free daily self-check-in guide to reconnect with your body, your emotions, and your power. The link is in the description. And stay tuned for more science-backed truth, mindset rewiring, and trauma-informed healing. Until next time, take care.